Hello everyone, welcome to sqadia.com. My name is Dr. Saima Mushtaq and today we will talk about clinical examination of the gynecological patient. We divided this lecture into 5 sections. In the first section, we will talk about history taking, in which we will discuss about menstrual history and obstetric history, any past medical and surgical history, family and personal history. Then in the second section, we will talk about the examination of the gynecological patient, in which we will talk about general and systemic examination, breast and abdominal examination, and pelvic examination. In the third section, we will talk about some diagnostic procedures done on gynecological patients, in which we will specifically talk about the different tests performed on urine and then on urethral discharge, any discharge from the vagina and the cervix. Then in the fourth section, we will talk about the cervical and vaginal smear for cytology study, then examination of cervical mucus and colposcopy, which is the procedure to examine or view the cervix. Then in the final section of our lecture topic, we will talk about imaging techniques in gynecology, and in which we will talk about the X-ray, CT scan, MRI, PET, then endometrial sampling and endoscopy. So all this will be covered in the lecture topic, clinical examination of gynecological patient. Hopefully you are interested to learn more about this topic. So keep watching sqadia.com to learn more about clinical examination of gynecological patient.